This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Well, you know, it's probably something most people have dealt with at least once in their life, but probably not something most people talk a whole lot about. I'm talking about ingrown toenails. Now, it happens when a piece of your toenail starts growing into the skin of your toe. If you get them and you're like most people, you probably pull out the nail clippers and start digging away. It's time to stop that habit because the doctors at Thomas Podiatry have a solution that will put an end to the problem once and for all. Dr. Brett DuPont of Thomas Podiatry sees a lot of different foot problems, but few more often than ingrown toenails.
We see a lot of them. It's one of the most common things that I see in the office pretty much every day.
Sometimes after the patient has tried to take matters into their own hands, or in this case, feet.
Yeah, they end up digging it out or trying to, sometimes making it worse, or they have to repeatedly do it month after month, year after year. But a lot of people come in and say that they've been doing it for 10 years and it finally got bad enough that they decided to see somebody.
Dr. DuPont says an ingrown toenail can get pretty painful.
It's irritation, redness, sometimes an infection that goes along with it. There can be bleeding, fluid drainage from the corner. It's basically irritation of the skin from the nail being curved down into the skin.
Ingrown toenails can happen to anyone, young and old, and have many different causes.
It can be a number of different factors. It can be tight shoes, sometimes cleats, sometimes people that play sports. A lot of times it is somewhat genetic because of the shape of the nail. So people that all run in families, I'll hear that a lot. Their parents had ingrown nails, their father, their mother. Also, sometimes it'll be on the same side of the toe on both feet, so the nails are shaped the same and it might curve down more on the outside versus the inside.
The good news is there's a way to put an end to ingrown toenails altogether.
I usually recommend a nail avulsion, which is trimming it down the side that it's ingrown on under the nail cuticle and actually removing that portion of the nail, and we use a chemical called phenol that actually kills the nail root so that portion of the nail doesn't grow back. It's usually successful in 98% of cases.
Dr. DuPont says it's a simple and relatively pain-free procedure that takes 15 to 30 minutes in the office, but once it's done, he says you'll be back on your feet in no time. And Dr. DuPont adds that if you have the procedure to remove the portion of nail that causes the problem, you probably won't even notice that the piece of that nail is missing because he removes such a tiny portion. He also says ingrown toenails are not a serious condition unless you're a diabetic. He says in that case, infection can become a concern. So the bottom line is don't suffer from reoccurring ingrown toenails. Get them treated once and for all.